Thanks so much for having me today. I think the prior talks have really done a great job of leading into this, but this segment is really focused on our medications, specifically getting these medications and staying on them in a sustainable way. So first, we're going to do a really quick flyby of medications that we use to treat Wilson. We'll mention the role of specialty pharmacies in dispensing these medications. And we'll really focus on some of the challenges that are facing us in our patients having trouble getting their medicines and some potential strategies that we can use to really overcome that. So quick summary here, we've got 3 main medications we're using to treat Wilson. We've got penicillamine, trientine, which comes in 2 forms, we'll talk about that later, and zinc. So your first 2 medications working to help eliminate that excess copper from the body, and then zinc helping to block the absorption of copper into the body. We're really focusing on these first 2 medications today because they tend to cause us the most access issues, and they are the most expensive. So wanted to mention zinc, but also not the focus for today. So real quickly, penicillamine is provided in various strengths of capsules and tablets. We've been using it for a long time, so it has a pretty well-known side effect profile. Some of these side effects can limit its use and tolerability in some patients, including potential neurologic symptom worsening. Some patients have trouble with their blood counts on the medication. It can also cause skin effects or reactions like rash as well. And we also have to be mindful of when we're taking this medication with respect to when we're eating meals and taking other medications and supplements. We've got trientine as well, and trientine has a great role because of its tolerability profile. It's a great tool we can use, especially in patients who are not tolerating penicillamine very well. We also have to be mindful with trientine of when we take it with regard to when we're eating meals, taking other meds and supplements, specifically iron. Really important to separate iron and trientine by at least 2 hours. So I'll mention the 2 forms of trientine that we have available to us. They're different, essentially chemical forms of the same active drug, but their characteristics are different. And that can come into play when we're thinking about integration into patients' lifestyles and things like that. So we've got trientine hydrochloride supplied as capsules, so the branded Cyprine, or available generics. We've got trientine hydrochloride, which is provided as scored tablets. So you can actually snap in half in a blister pack. That's provided as Couvreur. It is a branded only product right now, no generics. And the biggest thing that I think that really separates these 2 forms is how they're stored. So the trientine capsules just aren't as stable at room temperature, and so it's recommended to refrigerate it, whereas the trientine tablets are more stable at room temperature and do not have to be refrigerated. We think about that a lot when we think about patient convenience and integration into your lifestyle. And then I'll also mention kind of how we get those dispensed. And so the trientine tablets are only dispensed right now through a particular specialty pharmacy called Panther. And then trientine capsules are not restricted to that one particular site of dispensation. So real quickly, I'm mentioning specialty pharmacies, but what is that and how does it help? So these drugs are often regarded, honestly, normally by insurance, and labeled a specialty drug. And we use specialty pharmacies to really provide a suite of services to help that medication access journey be a little bit smoother. These pharmacies really have some extra tools available that maybe your neighborhood pharmacy would not. Really specific, or trying to hit on the fact that these are rare diseases and they have complex requirements and considerations. The drugs are also very expensive. And so that extra suite of services can really be enhanced by talking to a pharmacist that's maybe specially trained in this over the phone, trying to figure out financial navigation. And some of these pharmacies even have designations in rare diseases to help you. So some common challenges that we face getting our medications, this is a daily struggle in clinic. These medications are expensive, and people and insurances find a way to compensate for that. Kind of the first thing an insurance would do when it's faced with high drug spend is instituting a prior authorization. Some of you may have been through this process before. You know that it takes time. You know that it may be difficult. It may be time that you spend without your medications. Insurances will abide by their formularies, wanting you to try a particular medication first before you move on to another one. And this is burdensome on office staff as well, especially when you get a denial of one of these drugs and it's maybe not the ideal treatment. Do we decide to pivot to a different drug? Do we decide to fight it and try to appeal it? And so this is all very frustrating from, multiple accounts. Insurances also find ways to pay less and try to push that cost on the patient and or the manufacturer. So we need to know what some of these strategies are. Some insurances institute high deductible plans. Some of them make you pay a very high percentage cost share of your specialty medication. We know that folks with Medicare are facing some high copays, especially if those of you have heard of the donut hole. That's a historic issue with Medicare. Some commercial insurances, particularly ones provided by your work or employer, may even go further in trying to pay less by trying to drain every penny of a copay card that's available for a medication. Some of them even go as far as excluding coverage for all specialty medications to try to make the patient appear not covered or not insured for that particular drug, so that they hope that the manufacturer will come in, the drug company will come in and try to provide that medication for free so that the plan doesn't have to pay for it. So very controversial strategies here. There's manufacturer assistance programs. Many of you may use that to help with the cost of medications. Normally involves some paperwork, right? And then there's also some charitable resources out there, or grant funds, or funds of money that are specific or going towards patients with certain rare diseases that you might be able to apply for. But whenever there's grant funds available, there's often just not enough to go around. So thinking about some tools in your toolkit, and I've really broken this down by what type of insurance somebody has to kind of make it easier to match up the resource. So we do have resources for patients that do not have prescription insurance. We lean pretty heavily on manufacturer assistance programs in this case. So the drug company providing free drug to patients. Often these applications do involve some semblance of trying to connect the patient to a coverage in the future, specifically things like state Medicaid and things like that. We've got our commercial plans, so plans that would be provided by an employer that you work for, or marketplace plans are also considered commercial plans. We tend to use copay cards more for these types of plans, where as long as the plan pays some amount first, towards the drug, the copay card can swoop in and reduce that out-of-pocket cost for patients. Another tool that's not quite as well known is if you have a commercial plan and you're getting multiple denials for a specific drug that you need, you might actually be eligible for a free drug program as well, either in the long term or even in the short term temporarily until you do get access through your insurance. For our Medicare prescription drug folks, our biggest struggle here is the high copays. It's not necessarily the authorization part. Can't use copay cards, that's illegal. And then I think this really calls for extra help in the charitable grant fund space to try to help with this. There's also something called low income subsidy. It's a program through Medicare. It's also called the Extra Help Program. You can apply through the Social Security office. I will say that the criteria for this is pretty strict. They look at your household income, they look at your assets, and if you're approved, it can help with your premiums and lower your copays pretty substantially. We have our manufacturer assistance programs. Most of those do allow Medicare patients to apply. You just have to hit certain criteria. Most of that's based on annual household income. There may be certain manufacturers, I know that Bausch has allowed this before, looking at monthly copay to income ratio to justify financial hardship as well. But these criteria do change over time, normally at least yearly, but they can change them at any time, so we need to keep up with that. Other resources that maybe aren't quite as advertised, there may be some charitable options through maybe like the hospital system or the provider office that you are receiving care at. Disease associations may be able to help, even if it's not with the cost of medication, maybe the cost of like transportation and things like that for your medical care. For medication specifically, I know a lot of specialty pharmacies actually have their own internal assistance or hardship funds or programs that patients can apply to that can be really good resources. I use that a lot in my daily practice. And some of these pharmacies, maybe if they don't have one of these programs, maybe you could even ask if they have a payment plan where you can split up your payments over time so it's less burdensome. In 2025, we've got something on the horizon that's very exciting for our Medicare patients. So as a result of the Inflation Reduction Act, we are now going to see a yearly out-of-pocket prescription drug cap of $2,000 for our Medicare Part D patients. And then once you hit that amount of drug spend out of pocket, your copay is then reduced to zero for the rest of the year. Very exciting. We have not had anything like this before that has really increased our access in this way. Some years before, we haven't even had a drug cap, and you just keep paying 5% until Kingdom Come. So this is really exciting, and I think really puts the onus on, in my opinion, grant funding to try and hit that cap, because it is a set cap, and hopefully we can get you down to zero after that. There is going to be an option as well through Medicare D to spread out your prescription copays, not as a lump sum, but actually spread out over a monthly payment too. So all of this said, medication access is very difficult, especially in this day and age where these medications are so expensive, and there's just so many entities trying to play chicken with each other of who's going to pay. And so really we need to know our resources here, and really matching up the right tool with the right job and in the right scenario at the right time. And there is no harm in asking for help. Truly, there's so many resources around you, and there's so many people that want to help, that are on your team. I always say that it takes a village sometimes to really get patients to stay on their medications in a sustainable way. So ask for help. And with that, thank you very much.